if you have a very specific expectation about what it's going to do for you, like I'm going to have this libido, I'm going to have, erection every morning, I'm going to just jump out of bed and want to go work out, and it's just going to be great, you're going to be disappointed because it's not going to do that for you.
You just hopefully feel a little better, but don't forget, you can't out-human being human. There's no drug that you will take that will out-human you being a human.
So welcome back to the TRT and Hormone Optimization YouTube channel with two guests today. We have with us Dr. Keith Nichols and Amir Karkouti. Welcome back, guys.
Good to see you, Stephen. Good to see you, Amir. Nice.
Thank you. Here. You too, Dr. Keith. You've been an inspiration since I've been on TRT for a very long time. So to be on with both Stephen and you is an honor. So thank you both, you guys, for being on here.
Thank you. Thank you as well. My pleasure.
You're welcome. So, Amir, today we're talking about the mindset we need to start or to be on TRT, and Dr. Keith Nichols is going to help us with those things. So maybe start out, Amir, why did you want to talk about that?
So interesting. Last podcast we did was on PFS, and the biggest thing that I got out of that, I got a lot of emails, a lot of social media messages that said, that was very powerful. That was so impactful. There were so many things that I needed to hear. Number one, getting off social media and getting off a lot of those like Reddit and things like that, and spending 5 hours a night when you should be sleeping, getting on those forums and trying to figure out what to do instead of getting a professional to fix you. Things like that. So I was getting like, what do you do for feeling better? How do you explain it to your wife? What about when your friends ask you, what should I not tell people? All these questions that started to come up. So I thought it'd be valuable, not just for people who have PFS, but people in general, men in general. I'm going to speak for men because I'm a man. So men in general, that TRT is not just sticking yourself with a needle and then an amazing time, or putting on transscrotal cream and things just magically start to get better. There's a lot of things that we don't take into account that will exponentially make this journey much better than just doing what we call testosterone replacement therapy. That's one of the aspects that I think is extremely important. But if you don't have the other variables figured out, it's not going to just be roses and a beautiful, beautiful time, if that makes sense. And we were talking before the show. Keith said, this is going to be your podcast. But to be honest, Keith, like I've already mentioned, he's an incredible wealth of knowledge, and I'd love to have his, take on it as we progress on this call.
Right, Keith?
Be glad to. Enjoy the PFS podcast. I was able to watch it twice at least, and enjoyed a lot of the points. And I was extremely pleased with your points on social media and forums. So be glad to touch more on that as you get going here today. But that was great insight, great advice. And I've tried to give that advice for years, but certainly we'll talk more about that today.
Absolutely.
Mm-hmm. And what would you tell men that are experiencing low T symptoms before they go to their provider? Is there a certain mindset they need to get in touch with the doctor?
So that's a really good question. What to do beforehand. So here's something. One of my colleagues, I do executive coaching, and I own restaurants. I've written books, worked at a recovery center. All that aside, why I just told you that is because when I had low T symptoms, I did not want to write a book. I did not want to go to my stores. I did not want to spend. I just wanted to do nothing. And I had PFS, which was really, really exhausting. So here's a couple things that I think are incredibly valuable when I found out that not only did I have low testosterone, I had what's called post-finasteride syndrome, which messed up my libido. I had suicidal ideation. I had a host of mental, physical, and you can even say spiritual, like I was messed up all over the place. And one of the things my colleague had pointed out a long time ago, and I actually wrote it down, I have a couple notes here. He said, if you're doing things in order to be happy, you are doing it in the wrong order. Okay, this is very important. If you're doing things in order to be happy, then you're doing it in the wrong order. What does that mean? So once I found out what was going on with me, a lot of people do this thing where they say, once I get fixed, then I'll have a good life. Once I get better, then I'll go back to my life and live it. Once I get my hormones in check, then I will X, Y, and Z, which is extremely backwards. The whole point of why we do TRT, or why I wanted to get my hormones fixed, is to live a happy life. And my wife pointed out as well as, well, why don't you live a happy life now? Why wait? Right? This idea that this magic thing is going to happen in the future. Here's something I will tell you as an adult. You might fix your hormones today. Someone might have cancer tomorrow. You might fix your hormones today. You may lose day. So if you have this idea that once you get somewhere, then you'll live your life. I don't want to bust you guys' bubble. There is such thing, because life is a contact sport. And if you're waiting for all the ducks to be in a row, it's not gonna work out. So rule number one for people who are going to their doctor, right? Make a commitment. And you'll notice something. Dr. Keith Nichols and Dr. Devos, they're doctors, and look how fit they are. They're fit, and I assure you that this is a lifestyle that they've had, right? So rule number one is, when I was on my lowest part of my life, those are the moments I made the biggest commitments. What were those commitments? That I'm going to spend time with my family, that I'm going to try to work out the best I could. It was very difficult with PFS. So my wife would say, get your butt outside and let's go walk. Even though I could barely lift a weight, she made me move. So couple things. When you're just starting, where you found out that your testosterone's low, start making commitments today at your lowest points. Don't wait until 8 months from now, when you think you're going to be at your peak, and because sometimes it takes a long time, right? So make those commitments now. What does that mean? Start doing things you can do right now. Eat right, sleep, get off the forums, go read a good book at night instead of being on those forums scrolling. Learn something, right? Get a book on educating yourself about hormones, educating yourself about how to eat properly, how to work out. Like, spend time becoming a better man as you go on your journey to fix your hormones. Because what I've noticed what a lot of men do is they have this waiting game. No, I'll do that afterwards. It's a terrible strategy, because afterwards, I will assure you, you will find other things that you will find wrong. And if your mindset continues to be that way, then you're always going to have that carrot dangling in front of you, waiting for the perfect time to live your life. And Keith, I don't know if that's something you agree with or disagree with, or
I agree
any
with
thoughts on that?
I fully agree with it. You'll hear me say it all the time. You're right. You do have to, first and foremost, make a commitment to self-improvement. You have to make that commitment. And then once you do that, you've got to be willing to sacrifice. And what you had that many men don't have, Amir, but they're looking for, and they think that maybe testosterone provided for them, but it will not. Once you've accomplished your commitment and you're willing to really, truly sacrifice, then you really have to have the determination, the strength, the endurance, and the discipline to really see it through. And what you had was extreme discipline. You had extreme determination. You had extreme strength, not just physical. We're talking about the mental strength to force yourself to do something that you didn't feel like doing. I've been there as well. We say it all the time, motivation comes from within. You're not going to take testosterone all of a sudden wake up motivated. You're not going to undo years of bad eating, bad lifestyle, bad habits. You're still going to have those habits when you start. You have to be willing to make that commitment to break those habits. But that takes motivation, which comes from within. If you can't find it, we can't provide it for you in the form of a syringe or a cream or a gel. You've got to be able to do that yourself. And Amir, many men just aren't ready, or maybe don't know how. I find most of my job a lot of times is about coaching, and hormones will not overcome life. They will not overcome life. We're taking men that have symptoms of a deficiency, and we're improving those symptoms. We're giving them testosterone to overcome the symptoms, but then that makes them a normal individual, subject to all the problems that we as humans have. And that affects how we feel and function every day. So I couldn't be more on board with what you're saying. Would love to hear more.
Absolutely. And so I'll give you an example of, well said, by the way. One of an example is, I had a gentleman private message me and said, I think I have PFS. post-finasteride syndrome, and my libido seems to be worse than it was last year. I didn't know what he looked like, didn't know who he was. I said, let me ask you something. How old are you, and how much do you weigh, and how tall are you? I think he was 34 years old, 5'6", 240 pounds. Okay.
Yeah.
Now, men that are listening to this call, I have no idea. First of all, I'm not a medical doctor. Okay. So I'm not speaking from that perspective, but I will tell you, when you're 240 pounds and you're 5'6", you have way too many variables to know what the heck is going on with your body. Here's what I did. Okay. When I went, as Stephen, going back to Stephen's question, what if your testosterone's low, right? When I went to my doctor, I tried to remove every single possible variable I could before I showed up to the doctor, because he didn't have to say to me, well, you have to work on your weight. You're inflamed because you're eating a bunch of trash. You don't seem to be out in nature, so we don't know if it's or you're stressed out. All of those things can mess and can look very identical to people that have low testosterone. I have friends that don't have low testosterone, but they have depression, they have anxiety, they have low libido, they have all very similar symptoms. So what I did before I stepped into a doctor's office, I removed those variables. You have that obligation. You should have that obligation for yourself, for your family, for your own well-being, to come in to as the best possible man before you even decide to do something, to the best of your ability. Because I understand, when I had PFS, it was easier said than done. I understand that, but it's very important when I say to the best of your to the best of your ability. So if you can't run a marathon, go outside for 10 minutes. If you can't go out for 10 minutes, do it for 5 minutes. Right? If you go to your pantry right now, you can do this while you have low testosterone. Get rid of the trash that's in your pantry. You can do that before you step foot in your doctor's office, because what that's going to do, and as Dr. Nichols pointed out too, is if you get on hormone replacement therapy, and there's going to be some time where you're going to fluctuate, and it's going to be some crappy days, some really good days, and it's going to be all over the place, right? If you're on a boat and you're going the wrong direction, and now you're adding hormone replacement, you may be going in the wrong direction a lot faster, because, like I said, you may start seeing that it's not that easy of a route right away. It's going to take some time. And if you have a terrible provider, it could be a very long time, right? There's not everybody's Dr. Keith Nichols, right? So that's the thing. So fix your variables. I can't stress this enough. The calls I get that say, oh, yeah, I think I have PFS, or I have low testosterone. Well, what does your day look like? I play video games for 5 hours. I'm downstairs at my parents' house in a pitch black room just playing video games. Do you go out with your friends? No, I'm insecure, and I left my friends because my testosterone's low. Do you do anything outside of just being in your room? No, not. I'm waiting until my hormones get better. Men, what the hell are you doing? Stop that nonsense. Get yourself to the peak that you can, and then work from there. It just gets better. It gets better from when you're at your optimum place you can be without hormones, to the best of your ability. And then when you go to Dr. Keith Nichols and say, Doc, I'm fit to the best of my ability. My stress levels, I've learned to reduce that. I'm spending more time with my wife. I've done, if you're spiritual or if you're religious, I'm going to church now on Sundays. I've done everything I can, Doc. Here's what I'm seeing in my blood work. Can you work with me? I promise you, Dr. Keith Nichols will have a lot more success, and I'll let him speak to that, than if you come in overweight, sitting in your room all day, leaving your friends behind, not talking to your wife, and being miserable, and then having Keith be your savior. I just don't think that's the avenue we should take.
Mm-hmm. Yeah, great. I think you agreed, Keith.
I will, and I'll give you a couple of other sides of the coin on that. Okay, so we can take the same 5'6", 241-pound gentleman that Amir was talking about, and when we try to have that conversation with him, sometimes they'll be the first to say, you know what? No, I eat good. I exercise regularly. I don't have any stress. That's a problem. That's just going to be a problem because we know none of those can be true, but yet their perception is their reality. And when I found that, if you've got to be an intelligent, mature man that's willing to step back and take a critical analysis of his life and his habits, and those that are willing to do that, they'll succeed. Those that won't will not. There is not an easy button. When it comes to doing what we do, and when it comes to changing those habits, you better get comfortable being uncomfortable, because those that can't do that are not going to be successful in what we do. If you're not willing to be hungry, you're not going to lose weight. And a lot of people to the age, I don't want to be hungry. Well, then you're not going to lose weight. You have to be in a caloric deficit, just as far as weight loss goes. So you've got to be comfortable being uncomfortable. What testosterone will do, as we talked about in one of our last podcasts, is that, look, it will reward effort, but you got to put in the effort. That individual has to put in the sweat equity. And if they don't, we won't be successful. So, each individual, their perception is their reality. And I've learned that I cannot change that. I don't try to convince or talk them into that anymore. I just, I'll do my best to optimize their hormones, and I will try to coach them to some degree. But if they're not going to be reasonable about their own input or lack thereof, then they're not going to have success, and they'll be the ones on forums and continue looking for that easy button, whether it be, the newest, greatest peptide or this, that, and the other, instead of really getting down to your foundation of health, which is always nutrition, exercise, and hormone optimization. You have to do them all. And on the other side of a different coin, Amir, is, look, there are some men out there that are listening to that. And they're going, look, I want to get off the couch. I want to do something, but I just can't. I literally have no energy. My fatigue is so great. It feels like what a cancer patient must be going through, getting radiation and chemotherapy. I was that guy as well. I literally got to the point where, even though I didn't look the part, I was less than 10% body fat. It was a mountain bike racer, and I just didn't fit that bill. But man, I got to the point where it was just a show. I could get through most of the day, but around 4 or 5 o'clock, I hit that wall, and I was just exhausted. And I was a miserable human being. And I couldn't do the things that I always had done, no matter how much I wanted to. And if I did, I suffered for days afterwards, couldn't recover, and things were just worse. I just thought if I got enough sleep, it'd all be better. And then I almost got addicted to Ambien and Lunesta, the sleep aids. And so it was a nightmare for somebody that had always been so active. So I hear that those guys are out there like that want to so bad. So for you guys that really do have the motivation and desire, but you literally can't, not because you're too lazy. There's a difference. The guys that we talked about beforehand, I hate to use that word, but they're just lazy. They're going to be lazy.
Absolutely.
And then there's guys that don't want to be lazy. They literally have always lived an active life. The last thing they want to be is lazy. In fact, they're ashamed that they're being lazy. They're mad at themselves on a constant basis that they can't do what they've always done despite wanting to every day. And those guys, yes, testosterone is a lifesaver. It's a lifesaver for me. It's exactly why I do what I do today. I was that guy. I went through it. I had a successful spine and sports practice. I was with all the pro athletes, the UFC title fights with, the Nashville Predators of the Hockey League, one of their physicians for 10 years, the Tennessee Titans football for 2 years. I mean, I was dealing with pro athletes and enjoyed every bit of it. But I was mismanaged, misdiagnosed, mistreated by my own colleagues. I had to figure this out for myself. And that's why I sit here today talking to gentlemen like you, is because of what I personally went through. So I see both sides of the coin. We got a lazy side, we got a side that knows there's something wrong, and they don't know how to fix it, and they need someone to help them fix it. And then unfortunately, some of those men will find good providers, and then some will resort to forums and bad providers. And that's where the clash will occur with good advice, evidence-based advice versus non-evidence-based advice. And so you touched on that on your PFS podcast, which is very great. You've already touched on a little bit here, so I'd love to hear more. But yes, I just was going to give you the other side of the coin, because you've been there, I've been there, but we weren't that guy that just really never did learn to exercise right, eat correctly. Nobody ever taught him, and so we got a different side. And the hard part is convincing those guys to get up and move to improve the quality of their life for not just them, but for their loved ones and everyone else as well.
I absolutely agree with you, and that's a good distinction, because I want to make it clear this is not a blanket statement for everyone. However, if you are somebody that's on there, and to attest to what Dr. Keith Nichols said, is I was that guy too. I could not keep my eyes open. I have a chain of restaurants here in San Diego. I would drive to my stores. I'd have to pull over and sleep. It was mind-boggling for me, and it was driving me insane. And my wife would tell me, hey, we're doing this with our friends later on, and we're going to go to dinner with our best friends. And I say, absolutely. I would go to go get dressed, and I'd come back and say, where are we going? And she'd look at me like I had Alzheimer's. It was really that bad. So I get that. So here's where, for those that are in that situation, okay, I have the only advice I would say is do the best you can and don't beat yourself up. Okay. Don't beat yourself up, because guys like me, I'm sure Dr. Nichols, like I'm one of those go-getters. As you can see, I'm I'm a go guy. And the first person I will beat up when I don't succeed is myself.
Mm-hmm.
And I've learned to forgive myself for something that I had no control over, and it was very difficult. And that allowed me to open up to myself and be more vulnerable to my wife, because what happened for me is I would shut down. I don't want other people to know what's going on in my world. So a lot of guys that were in my situation, when they call me and say, look, I'm not a weak man. I own a business. I was a bodybuilder. I was this and that. And then I say, well, does your wife know, or does anyone know? And they keep it to themselves. They say, no, I'm a man. I don't talk. And here's the thing, you guys. When we're in this place, we can't do this alone. Find people that you can discuss this. I trust me. Here's what's crazy. And when I've had PFS, okay, when I finally opened up, I started to share with my other friends. You will not believe it. I had 3 close friends tell me that they took finasteride and they had similar symptoms. And I went, why did you not tell me? And for the same reason as we're discussing, they said, well, it's embarrassing. I'm a man. And I went, how you could have helped me. You could have helped 10 of your friends that are on finasteride had you shared that. So if you're there and you're listening, slow down for a minute, take a breather, and know that you have people like Dr. Nichols. There are good doctors out there that can help you, that want to be by your side. Start creating the team to get you closer to your health. That's all I will tell you. And the team doesn't necessarily have to be just a doctor. A team can be your partner, your wife, a close friend, a therapist. It doesn't matter. It could be whoever it is. But do not do this alone. It's a long process. So yes, in that respect, Dr. Nichols, I absolutely agree with you.
Mm-hmm. Awesome. Amir, once as a man, you get in front of the doctor, of the provider for the first time, what's the mindset you need there? Do you need to be critical, well-informed, or do you have to trust him and go with his experience?
So, for me, it's an interesting situation. After a doctor gave me a drug that completely ruined me, I didn't trust any doctor. The minute one doctor tells me, take this pill for hair loss. And he also told me, you're going to have a lower chance of getting prostate cancer with this pill. So it's 2 for, and then down the line, I found out I can't have sex with my wife for 5 years. Any doctor that said, oh no, I can help you, there's a big resistance. So there is a fine line between being cynical and skeptical. Okay. There's a fine line between being cynical and skeptical. And I will tell you, it was a hard process for me to find a doctor, because I went to a celebrity hormone doctor that I thought was going to give me the magic thing. He put me on a terrible protocol, put me on Arimidex, which I didn't know what it was at the time. And that got me in a whole host of other situations. Then I went to another doctor who...
Amir, not to interrupt you, but because that was in your first video, your PFS video, and you're out in California, I can guess who you probably saw based on the protocol that you outlined.
Yeah.
And
okay.
Man probably starts with an R, I would guess.
Yes.
And
Yep.
last name with an M.
Yep.
So the point is, guys,
that's correct.
Don't get misled. by bright and shiny.
Yeah.
Don't get, just because they've got a big YouTube following from bodybuilders or this, that, and the other, packaging, marketing, don't get sucked into that.
Yeah.
Do not get sucked into that, because Amir thought he was going the best of the best because we get on
Absolutely.
YouTube, but yet you found out that that's not really the case. So you better do a little more vetting. Not you, but you understand. I mean, now
No, absolutely. And
you take a
no,
different approach because you know so much more now. So I caught that on your first podcast.
yeah, that's exactly right.
Twice. It was excellent. And so, please keep going. But the take home message there is, guys, you've got, be careful in that the ones that are getting the most hit out there with the millions of followers, or however many they are, hundreds of thousands, does not make them the best or know exactly what they're doing or the best for you. That's just going to be the truth. We know them all. We know them inside and out. And so that's just, Amir found out the hard way.
I found out the hard way, and I kept finding out the hard way, because after that, you get deflated. You thought you're going to this, and these are not cheap doctors either. These are very expensive doctors. I went to the top of the top, and I had to drive a couple hours to see these, doctors. I'm in San Diego. So it wasn't like I was willing to also fly to Chicago. I didn't care where I needed to. I just wanted to get help. So the mindset, I guess, is do diligence. And number two, this is very important. Okay. And I'll let Dr. Nichols touch on how to find a proper provider, because that's above my pay grade. But take your time. There is no rush. I know what I mean by that is when I finally found a proper doctor, right, who was Dr. Neil Rousier trained. They know what they're doing. I love my doctor now. He actually mentioned for me to take my time too, which was really good, right? And also, the one thing that I realized is, if you have a good doctor, and that's where I'm going to let him share how to find one, if there is a way, is listen to them. Don't jump on social media and say, my doctor's making me do X, Y, and Z on all this stuff. Should I change my protocol tomorrow? Right? In other words, if you have a proper provider, the point is, he or she is monitoring you. Trust the process and go back to life. I see so many people going back to forums saying, well, I'm not going to tell my doctor, but I think I'm getting a zit on my face, so I'm going to reduce my testosterone, or I'm increasing my thyroid. Don't do that. Don't listen to your provider. Slow down. And you know what'll be more valuable? Go give your wife a kiss and a hug. Go spend time with your kids afterwards. Go grab your wife and go get dinner. Go on a walk. In other words, let your doctor do the doctor thing, and you go back and do life again. Because I know we've been burned so much, we think it's our job to now manage ourselves, manage our protocol, and even manage our doctors. And I think it's a terrible idea. So set it and forget it. And I'm going to say this again, because on the last video, I had all these people leave comments and say, oh, what do you mean set it and forget it? What if your doctor's terrible? I'm going to, this caveat is, when you find a doctor like Dr. Nichols, or the doctors that have been vetted, set it and forget it, trust their process, and go back to life. And Dr. Nichols, I'll let you go from here.
Well, no, that's great advice. There's nothing more frustrating than whenever you look on a forum where, it's inevitable. You go there right now on any of them. Hey, a doctor just started me on all this. What do you think? What should I do? Is this a good? There's nothing worse than that. I mean, obviously they have no confidence in their physician whatsoever. And then they're willing to go into a forum where you don't know anything about anybody answering any of your questions. When else would you do that? If you had cancer or any other major disorder, would you just go and take some advice from, Bill or Bob, who's no telling where they are? They may not even be in the United States, but nonetheless, You're getting advice from someone that you know absolutely nothing about. And if you probably met them in person, it would probably be the last person you got advice from. And plus, anybody that's got time to be on forums giving advice, probably not going to be very busy and doesn't have much of a life otherwise, because I'm always so proud of my guys. I don't really see any of them on forums. I used to scour them just to see, and I don't have the time anymore. But I'm so proud, because my job is to get them optimal where they don't have to worry about exactly what Amir is trying to say, is that you get your, you got to get with the physician, that get your hormones optimal where you realize just check that box and go on and spend time with your wife, your kids, your friends, your hobbies, your work, your career. That's the goal. That is the whole goal, where you're not thinking about it all the time. And that's really what optimization is. When you wake up, it becomes just like putting on your deodorant or putting in your hair gel or whatever you may do in the morning. It's the same thing. You just don't even think about it anymore. We have good days, bad days, good weeks, bad weeks, good libido days, weeks, bad. It's just part of being human, part of life. But to touch on what Amir did say is that, look, there's so many T-mills opening up on every corner now. You can't get on social media at all without some, online testosterone clinic. I'd be careful about any of those. Yes, for the most of the guys that just want to get on for performance enhancement, it's great for them. But we're talking about people that truly want to do it for health and prevention and for a long-term with their provider. They want a long-term relationship with them. If you go to a website and there's no physician listed, that's a big red flag right away. Who's treating you? Who's dictating care? Yeah, I got it. It's your, celebrity on YouTube or whoever, and they've hired some, wounded physician that, they won't even name on their website to do your treatment. That's kind of a red flag there. But first and foremost, if you're having to go to a forum to ask questions, that probably means that either you don't trust your physician or you don't have access to them. Now that's a problem in and of itself. Now, like it or hate it, all my guys, females, they have complete access to me 7 days a week. I mean, I answer my messages every day, all day long, and even on weekends. So there's never a time. And when it comes to, treating patients, look, it's an informed patient is a really good patient. So if someone comes in and asks, for instance, what Amir went through, hey doc, I'm losing my hair. I want to start finasteride. Well, okay, Bill, but I'm going to send you some literature. And these are the risks that you're willing to accept if you start finasteride. So the point is that they should be willing to provide you with medical literature on about any topic that you may want concerning hormones or medications associated with hormone use, like for hair loss. So access I think, is critical. I don't use any intermediaries. I don't have a nurse practitioner or PA. I mean, it's always been this way. It's the way I wanted it set up. I didn't want to be the 800-pound gorilla and, like some of these multi-specialty clinics are. I deal with every man on an individual basis, like it or hate it, but that's the way that is. So I do agree on you there, Amir. But if you have to resort to a forum, then we have a problem one place or the other, whether it be with the provider that you've got or you yourself don't trust him for whatever reason. You need to find that provider that's willing to provide you with the information and answer your questions. And look, we as providers, the ones that are Neil Rousier trained, that are, he's my good friend and colleague. I always have to make a shout out to him. I talk to him on a weekly basis. He's just a great friend and a mentor. But look, we're not here to always tell you what you want to hear. We're here to improve the quality of your life. And just like when I was dealing with the pro athletes and watching the coach deal with those professionals, we'll treat you like, sometimes we have to tell you things you don't want to hear. So that's the problem. And, taking testosterone, let me excuse my language here. I used to say it all the time, but I'll say, but look, it doesn't light a fire into your ass. You have to do that yourself. You've got to, once you get it, you've got to do that yourself. And, lying to your provider, yeah, doc, I'm eating right, I'm exercising right, but I'm still having all these other issues. Be upfront and honest. And that's what I'm so proud about my population, man, is my proudest days are whenever I'll see a follow-up form, the yearly follow-up, whatever. Doc, man, I'm having these issues. I'm doing great otherwise, but look, I'm only having those issues because this is what I'm going through. I'm having stress related to this. Has nothing to do with hormones. My hormones are awesome, man. Thank you so much. Those guys got it. They understand. And they'll say that I'm just, not sleeping well. And, I'm just, libido's down a little because I'm working 14 hours days and it's really stressed about projects I got going on. Those are the great guys to treat because they're just realists. They understand that we're all human and hormones don't make us superhuman. These guys on forums think that you can tweak these hormones during periods of stress and always have this sustained period of nirvana. That's never going to occur, guys. Life is not fun. Life is not easy. Life is hard. And you just got to roll with the punches. And testosterone doesn't necessarily make that any easier. It just makes you a person that can address those things without having symptoms of a deficiency. And and also we got to touch on this fact that you see it all the time. I feel great. I feel awesome. That misleads so many people out there. Stephen, Amir, and myself, we don't feel awesome all the time. We don't feel great all the time. We do not. Look, when we talk about how great we feel, Amir especially, myself especially, I don't know if Stephen went through the severe symptoms of deficiency. He probably smart enough to catch it earlier than I was, but nonetheless, look, it's a relative term. Relative. I feel great compared to how I felt before. That doesn't mean I feel great every day. So those guys out there, they mishear that and they think they're going to feel great all the time. And when they don't, when they have these down week or two, then something must be wrong. No, that's just not true. And we'll get messages where, look, let's all be upfront and honest. Or we'll get, Doc, I've had fatigue for the last, for 10 days and my libido hadn't been where it should be. Okay, well, join the crowd. That happens to all of us. I mean, okay, thanks for letting me know. But look, we don't, those kind of guys, we can't just tweak something real quick and make that go away, because if you just say, look, all right, you give it another 10 days, inevitably you don't give a phone call back in the 99.99% of the time, because it just comes full circle back around. That's just part of life. And we don't need to, make it out to be something that it's not. We're improving symptoms of a deficiency. That's what we're doing. We're trying to take a person and make them a normal human being that was having symptoms related to low testosterone. That's all that it is. We make them a normal man, not a deficient man. That's all it is.
I love that. That's very well said.
Yeah, that's a great point, Keith. You don't need to change your protocol because you have a few days that you aren't feeling that great. That's an excellent point. Anything you want to add there, Amir?
No, the only thing that I would say is, like, there's something that in my coaching, I talk about something called ROI, which many of you guys know, which is return on investment, versus ROL, right? Which is return on life, right? When we do a return on investment versus return on life, return on investment, right? Which is, what can I get from this doctor? What's going to happen? And then it's constantly worrying about fixing your numbers, fixing all the medical stuff, meanwhile forgetting to return back to life. I will stress this out over and over again, right? When with being on testosterone, and Dr. Nichols pointed out, I had PFS. I went from where I was absolutely miserable to quote unquote feeling great. But you're absolutely right. You speak to my wife and she says, you're not having sex with me all the time. We're not going at it twice a day or all that. I have work. We have a daughter. I'm exhausted. We'd rather watch sometimes a movie than get down. And that's just what happens, right? I'm 45 years old. But with that being said, the most important factor on this investment is I got to go back to life. So when I'm tired, welcome to the human race. I'm tired. Until the next day when I'm not, I'll take advantage of there's days where I bad mood, right? So I am in a bad mood until I'm not. And when I'm in a good mood, I take advantage of it. Why do I take advantage of it? Because I knew how it felt before I was on testosterone replacement. And I'm incredibly grateful for being where I'm at today. So I'll take the bad days. I'll take the days where I'm tired. I'll take the days where I'm bitter or angry or depressed for a day. I'll take that any day from where I was before. Even though it's relative, I'm extremely grateful for where I'm at today, but I still have human days. That's the whole point. We're going back to being human, right? I was subhuman before, where I just felt like crap a lot more days than I do now, but I'm now grateful for the highs and I'm graceful with my lows. Okay. I'm very grateful that I feel good, and I try to be graceful to the best that I can when I'm not feeling good, and that's okay now. Now, for those that are like, man, I can't wait to get on testosterone, you can practice that as you are on your journey going on TRT. You can practice being grateful when you're feeling good. You may not be as good as I feel right now. Your peaks and lows might be like just like that, but be grateful when you have a moment of clarity. And don't beat yourself up when you're down. And then when you work with Dr. Nichols, You're going to be more grateful when you have more highs, and still be graceful when you're on your lows. In other words, the framework still doesn't change. You just hopefully feel a little better, but don't forget, you can't out-human being human. There's no drug that you will take that will out-human you being a human. What does that mean? You're going to have great days, bad days. You're going to have good moods. You're going to have bad moods. You're going to feel insecure about your money today, and you feel secure about your money tomorrow. You're going to have every single thing that when you go to the bookstore and you go to the self-help section, there's a reason. The self-help section is bigger than the hormone section. It should be the hormones and stuff that should be bigger, because most of us should learn on how our body works. But it's the self-help section. Because why? Because no matter who you are and what you are, it's the human condition to feel our ups and downs.
Well, everything Amir just said should be packaged and sold. It was just pure gold. It was worth the price of admission. Everything he just said. We could actually just cut everything else out and just put that right in there and package it as is, Stephen. It could have been said any better. And I really appreciate it, Amir. And I'm just going to make sure everybody understands. We've all been on hormones, been on it for years. Stephen's in excellent shape. Amir's excellent shape, blah, blah, blah. Look, Amir, Stephen, do we have erections every morning? Any of us? Yeah. Yeah. Do we have a raging libido all the time? Yeah.
No.
Do we feel like, even Stephen, even you, do you feel like working out every day? And do you get a good workout every day?
Not every day.
No,
Every day.
of course you don't. Do you have to force yourself sometimes to go when you don't want to?
Sure.
Amir, you the same way?
100%.
You know,
100%.
these guys out there thinking that, and they do think this way because they see it on forums. Look, that is not what testosterone does, and that's what I always try to just be so honest with our patients and everyone. And you guys are so good at it too. Let's tell you the truth about what it does and doesn't do. And so, you know, the problem is you got all these younger guys in their teens and early 20s. Well, hell, I probably had an erection every day back then. Probably y'all did too. I don't know, but can't remember that far. But nonetheless, a lot different when you start getting into your late 30s and 40s and 50s. There's a big difference. Okay. And it's a big difference. We need to cherish all the wonderful days that we have on it and understand we're still going to have bad ones. And like I said before on a previous podcast with Steven, it's like the guys that are in their late 20s, really starting their early 30s, where life really becomes real. And I use the word stress, and they kind of misinterpret that because everybody thinks that stress has to be bad stress. No, stress does not. Weddings are stressful, or, you know, getting ready for a podcast can be stressful, even though it's not bad stress. It's stress. But I'll make a different word. When you start getting your, you know, late 20s, early 30s, you're usually married by then. You probably have young children. You're working on your career. You know, you've got a house payment, a car payment. You got to take care of the house, got to take care of the yard. Look, those are responsibilities. So with increased responsibilities, yeah, I'll use that word, that's stressful, but increased responsibilities, you don't have time to think about your libido every day, or whether you got an erection or not, or, you know, and sometimes you're just too damn tired to come home and work out because you've been doing all those things. So testosterone doesn't make us impervious to life, as Amir so eloquently, you know, stated. So I just want to make sure we're all real clear on that, is that getting on testosterone is not going to make you have a raging libido. And Amir, the problem with guys is that the ones that do really bad or have a really hard time are those with very specific expectations because of what they've read and heard from other men online or on forums mainly. If you have a very specific expectation about what it's going to do for you, like I'm going to have this libido, I'm going to have, you know, erection every morning, I'm going to just jump out of bed and want to go work out, and it's just going to be great, you're going to be disappointed because it's not going to do that for you. It's just not going to do that for you. And I don't want you to be disappointed. I want you to have at least some people out there that say, he told me the truth. He told me, he kind of told me what it was really going to be like, not this, you know, magical paradise where, as you talked about in the beginning of the podcast, where the sky is blue, the grass is green every day, birds are singing, and it's not that way, guys. It's not going to be that way. All right. So don't look for it to be, and you'll be much happier. It works in everybody, young and old, male and female. It works the same way. It provides you with the same benefits. And if you don't get better in certain areas with optimal testosterone levels, it's not testosterone. And that's where you have to be mature enough, smart enough to address the other issues that may be at cause. Okay. That's my, 2 cents worth in addition to what you had to say, Amir.
You know, Keith, I want to point out to what you said. That's actually good news. I want you guys to hear what he just said. You know why it's good news? That means it's your choice then. Because if you're waiting for a drug to make you happy or to make your life different, you're going to be in trouble. What Dr. Keith just pointed out to is that we want it to be in our control. That responsibility of being able to get better, being able to be in a different situation. If we are strictly relying on a medical doctor to give our life back, you're going to be you're not going to be in for a treat. Now, the doctor will facilitate and make your life better. Yes, if your hormones are bad, but do not wait, men, for somebody else to fix your eating habits, your workout habits, your relationship with your wife, your time with yourself, getting off the forums. Your doctor cannot be there for all that stuff. That's in your control. And you have no idea how impactful that stuff alone is, right? So here's something that I'm going to leave off with is I wrote this down. This is so important. No one chooses the disease, but we choose our focus. Okay, this is something I'm going to say it again. We do not choose our sickness or disease, but right this minute, men, we can choose what we focus on. So are you going to spend after this podcast going, oh yeah, you know what? That was great. But this guy on this forum says I need to put a coffee enema in my butt. And like, joking aside, I had someone email me and say, hey, you know, I have low testosterone. Someone said to put a coffee enema, it'll clean your liver. And I'm going, that's where you're at right now. Like you could have spent that 10 minutes building a better future, building a better present. And instead you're sitting there ruminating. And here's the other situation. If you don't fix the rumination now, I promise you're going to have a lot more to ruminate once you get on hormones. I promise you. Because you're going to have, I went through all these fluctuations and changes. And so fix slowing down. You didn't choose the disease, but you can choose the focus. If you notice yourself ruminating, settle yourself, relax. Okay. And then when you get on testosterone, settle yourself and relax. Before you get on hormones, go out in nature and have fun. But when you get on testosterone, this is really important, go out in nature and have fun. Do you see what's happening? What Dr. Nichols has been pointing to is go be human now and just be a better human once you're on testosterone if it helps you. But you have to do human things in the process. You cannot stop living. You cannot just do nothing. You got to go back to ROL, go to a return on your life. It will make a difference, right? And so I have a feeling when Dr. Nichols is honest with some people, they probably don't want to hear it. And so he might be the guy that's the bad guy in this. Oh, well, my doctor said I need to change my sleep habits, diet, and all this. I'll go to the magic bullet. I'm going to disappoint you, and Dr. Nichols will say the same. This hour was the magic bullet. We just gave you the magic bullet. There is no magic bullet. That's it. And if you're waiting for one, you're going to go and disappoint yourself with the doctors that are on YouTube and these magical doctors that are going to give you the magic bullet for, you know, thousands of dollars. And then you're going to go back to probably Dr. Nichols after you spent a lot of money, and he's going to say, go back to the basics. Folks, this is the magic. This is the behind the curtains, the Wizard of Oz. There is no magic bullet. There is no magic. It's patience, having the right protocol, and taking your time and having fun in the process, and loving your life, loving your family, loving your job to the best of your ability until we die. And that's it. And then we go on with our life. And so like, that's all I have to say for the day. And I don't know if there's much to talk about after this.
Well, not really. I will say that, you know, if you're going to a doctor that tells you what you want to hear just to keep you happy, that's probably not the one I would want to go to. I want to go to an honest one. I want one to tell me man to man the truth, whether I like it or not. And I like that in all aspects of my life. My friends, a true friend's going to tell me when I ask them a question, I really want the truthful answer. And that is the true definition of a friend, those that will. And so I do try to do that. And that Some people may not be as responsive as others because we're not used to that in life anymore. Everything's got to be sugar coated, but I'm there to get them results. And sometimes you have to kind of give them the coaches talk, if you will. I'll use it that. And when I tell men that first start, getting back to your 5'6", 241 is that look, what I try to say is, look, let's start anew. When you get testosterone, this needs to be the first day of your new life. And what you need to do before that is you need to clean all your house out of all that bad food that you've been eating. Clean it all out, because if it's not there, you can't eat it. And don't go by it, but start and just fill it with nutritious food. And then you've got to start with baby steps. We don't expect you to go right into the gym the first day, but look, anything you do today, whether it be a few push-ups or walking to the mailbox back, it's more than you did yesterday. And take that approach every day. Anything I do today is more than I did the day before. And then just let that build on itself, and you'll ultimately get where you want to be. It's a marathon, not a sprint. We all know that. You got to be patient with testosterone. I see the physical, the sexual, the mental aspects all coming together really most nicely between months 6 through 12, and they improve yearly. But that is with them putting in the sweat equity. You got to put in the sweat equity. With that, you'll see results. Once again, a real reward effort, but that effort is hard to start with for all of us. It's hard for all of us when you haven't been doing it. It's hard. You got to be disciplined like Amir was. Not everyone's as disciplined as he was and had that strength and determination. But take it from him, and what he said is, you just got to wake up and say, I want Amir's strength, determination. I want his discipline, his commitment. I'm willing to sacrifice like he was in order to get where I want to be. When you wake up and you do that, you'll be successful. And until you do, you will not. Here I go again. I'm going to say a bad word. Half-ass in, half-ass results out. You can't half-ass it, as our coaches would always say. You got to be all in, guys.
Yeah.
All aspects.
Oh, there's my daughter.
Okay. Uh-oh. There's soap in my mouth.
That's my little girl. And you know what? Here's the thing I will end it with. If you have a family, right? Get off this podcast. Look at your wife straight in the eye. Look at your daughter in the eye. Arya, come here. Hurry. Hurry. Come here. I want you guys to hear this out. Why does Daddy work out?
To get strong.
For who?
Me.
For you, right? Whenever I'm in the gym, and she's in the gym with me, I do every set that I do. I think about every single rep that I do. This one's for my wife. This is for my daughter. This one's for my health. Make commitments right now, gentlemen. Like when you're waiting for testosterone to make you masculine, you can have a masculine mindset right now. Don't wait for the testosterone. You're just going to be a better man if your hormones get situated. But practice being a better man now. Like, you know what I mean? Like the way, like I have a successful business, but I had a successful mindset before I got my business. You guys know the story. You give someone that has a bad mindset $1 million lottery ticket, in a year it goes away. You give a successful guy, a business owner, 100,000, he'll make it to 2 million by the end of the year. It's the same thing. Put in the sweat equity now, right? So when you're on hormone replacement therapy, you will be unstoppable. Yes, you're going to have those bad days, but practice that now. Go do, like Dr. Nichols said, if you can't do 10 push-ups, do one. I don't care. Do one, because then you're saying, I made a commitment to myself. Right. By the end of 2 weeks, you'll be at 3. You'll tripled it, right? And that becomes an exponential process, and you start seeing it in all other areas of your life. Here's another thing you can do. You can get off this podcast once you hear it and say to your wife, I have not been transparent to myself and to you. I'm going to be a better man today. You don't even have to do a push-up. You can be the person that you want to be a year from now, right this minute. There's nothing stopping us from doing that. I don't have any special skills that Dr. Nichols or Dr. Devos has. I don't have it. I just made a decision. Because right now, folks that are on here that are not where you want to be, you're making a decision too. You made a decision not to be the person you want. Also a decision. All right. So make the decision to be the person you want to be. So if you need to, get a pen and paper and say, who do I need to be in order to? It's very simple. Write it down, make a list, and put it on your wall. I did that. And here I am today. People say, oh, it's easy for you to say because you have muscles. It's because you have a business. It's easy for me to say because I had some point I had to make hard decisions in the past. So the hard decisions in the past allowed me to have the easy decisions you think I'm making today. You have that opportunity. Use it.
You can be a victim or you can persevere like Amir did. He persevered.
Bingo.
He persevered.
Yeah, this was golden, guys. Thank you so much. I think it will be a lot appreciated by a lot of men considering getting on TRT.
Thank you so much, both of you guys, for having me. Honestly, I feel like I'm talking to one of my favorite people. I have never met you, and I'm so glad that we got to do this together. It's exactly what I imagined. Dr. Devos, thank you for entrusting me with your group. And gentlemen, it was a pleasure.
Amir,
You're welcome.
wonderful, wonderful podcast there. You did a wonderful job, my friend. I know you're already extremely successful, but hopefully more of the health coaching will be in store for everyone as well.
I appreciate that, you guys. Thank you.
Yeah, you did very well. Thank you so much, both of you, and enjoy the rest of your weekend.
You too.
Pleasure.